Oh, great. I think it works well. I'm just going to try it again. I was talking about the risks of heart surgery earlier. Most people think that heart surgery is very dangerous, but over the last few decades, there have been such tremendous development in technology, equipment, and medical care that routine heart surgery, provided the patient is in reasonable condition, carries a very small risk. For instance, routine coronary bypass grafting probably carries a risk of 1 to 2%. Now, when we look at the longer term results, though, say over even medium term or 4 to 5 years, there have been a lot of studies showing that after coronary bypass grafting, patients survive longer compared to patients who undergo coronary angioplasty and stenting, so-called PCI. All along, we know that after angioplasty and stenting, patients require repeat procedures and treatments because inevitably there is recurrence of the narrowing of the coronary arteries. Now, the possibility for repeat treatment only applies to those lucky ones who manage to get to the hospital in time and also are able to afford it. Sometimes things happen very suddenly that somebody while walking, shopping, or even playing golf may develop sudden cardiac arrest from blockage of the stented coronary artery. You can apply CPR and all kinds of other resuscitative measures, but the success rate is not very high. This is one of the reasons why, for the longer term period, patients who have recovered from coronary bypass surgery survive longer compared to those who undergo angioplasty and stenting. Now, there is a more immediate danger which is not frequently discussed. That is the procedure of angioplasty and stenting itself. In order to introduce anything into the coronary arteries, interventional cardiologists have to introduce guide wires, balloons, stents, and other instruments through the inside of the aorta before these can be negotiated into the small openings of the coronary arteries at the bottom of the aorta. Now, this process can carry a significant risk because, unfortunately, a lot of the patients that come for angioplasty and stenting or even routine coronary angiography have disease of the aorta plus the rest of the vascular tree. So whenever anything is introduced into the aorta, there's always a possibility of damage to the aorta, including knocking off atherosclerotic material from the wall of the aorta, which then flowing with the blood may then obstruct the arteries. The most feared situation is with the brain. Thus, when this happens, a process called embolism, certain parts of the brain artery is blocked, resulting in stroke or any degree of injury to the brain. Studies have shown that even after routine cardiac catheterization, the incidence of so-called silent stroke, that is, that stroke or brain injury that can be identified using MRI, can be as high as 32%. Luckily, most of these strokes are not clinically evident, but the damage is still damage. And this is probably why, in some cases, after routine coronary angiography or angioplasty, some patients develop some degree of depression in their mental acuity. So, coronary angioplasty and stenting carries a risk of initial complications and also in the long term, lesser survival compared to those patients who undergo coronary bypass grafting. This new way of doing coronary bypass grafting, which we call minimally invasive coronary bypass grafting, in which a small cut is made on the left side of the chest, and with this particular procedure, we can harvest and use both internal mammary artery without worrying about wound complications since the sternum is not open, and with clever anastomosis and fashioning of the anastomosis to the heart and coronary arteries, we can bypass all areas of the heart without having to attach anything to the aorta. In addition, since we are not using the heart machine, there is no necessity to cannulate the aorta. So this anaortic or no-touch aorta technique can drastically reduce the risk of stroke from manipulation of the aorta. In this situation, it's my belief that coronary bypass surgery is safer than percutaneous coronary angioplasty and stenting, because with the later procedure, there is no escape from introducing things into the aorta. And the advantage also in the long term of bypass surgery over angioplasty and stenting is evident. Thus, bypass surgery is safer and more durable, not only in the short term but also in the long term.